For those that are East Coasters, happy 7 o'clock a.m. For those that are from the Pacific West Coast, myself, happy 4 o'clock. So sometime along the way, our adrenals will show up, right? So we're going to talk about the commonalities in clinical practice between Alzheimer's, diabetes, and, of course, heart disease. We have to fuel the body properly, and as anybody that's listened to me speak, I go through the slides quickly. You can have all these slides. Just give me your email at the end of this presentation. I'll be more than glad to share all of these slides as a PowerPoint deck that you can use in your clinical practices as well. We know inflammation, of course, is a huge killer. And, of course, Time magazine got it right when they actually put this on their front cover. Sadly enough, they were actually considering Miley Cyrus for Person of the Year this last year, and they would have gotten that one wrong. So when it comes to inflammation, we know it's associated with cancer, heart disease, Alzheimer's. Inflammation is a common factor, as we all know. I measure C-reactive protein, interleukin levels all the time in my clinical practice. The question is, why do we have such an inflamed society? We'll discuss this today a little bit, but at the same time, we'll also discuss some very common thread prescribing techniques, things that we can use in our clinical practices that will address a multitude of things very efficiently per the peer-reviewed literature. So when I have my diabetic patients, and all of us have them, and we have our metabolic syndrome patients, those are waiting to step over that little magical line, I talk to them about structure and function. Structure begets function, and function begets structure. And, of course, we start seeing all the milieu of health conditions associated with, of course, diabetes. But I describe it this way to my patients: caramel corn. So, of course, remember when I started 22 years ago in clinical practice, we called it glycosylated hemoglobin. Now they call it HA1C, or some abbreviation like that. But it's really the difference between popcorn in the movie theater, kettle corn, caramel corn, and Cracker Jacks. That's how I describe it to my patients in terms of their cells being the popcorn kernels, so they can understand what's happening to them at a structural level and what's going on with those 60,000 miles of blood vessels, 100 billion neurons, 75 trillion cells, onwards and onwards. We're making caramel corn. So we have that imaginary line. Over the last 20 years, of course, that HA1C, glycosylated hemoglobin level has changed. I have a good colleague in Portland, Oregon. He's a medical doctor. His name is Miles Hassel. And before it was popular to do complementary alternative holistic medicine, he worked as an internist in a local hospital. And he says, I have an 80% success rate with reversing diabetes with diet and lifestyle. We know that. But he was, of course, a pioneer in the area. We know, of course, diabetes is an accelerant to everything above it. More infections, more Alzheimer's. We know now diabetes is known as, of course, Alzheimer's is called diabetes type 3. So we know it's going to accelerate all of these conditions, and it's not surprising that we're seeing this combination of things. I tell my patients, well, what do you do when you're looking for cancer in a body? You might give them a PET scan, give them some sugar, and see how the cancer cells light up because of that sugar. Actually, unfortunately, my father just recently got diagnosed with bladder cancer. He's a type 1 diabetic. His blood sugars are out of control, and guess what he's doing? He's urinating, of course, when you're above 200 blood sugar. All that blood sugar now is going through his urinary tract, feeding the cancer. Not a good thing. So when we do adrenal testing, how does that affect our inflammation levels? In my clinical practice, I have more people that are hypoadrenal, low adrenal function, and hyperadrenal. And think about it. If you have the normal 20 milligrams of hydrocortisone, you may quench the normal inflammation in your body. That's on a mellow day. But many of my patients present with a physiological production between 12 and 15 milligrams. So now they have breakaway inflammation, because after all, as I described to my patients, what do you do if you have a rash? You put hydrocortisone on. What do you do if you have a joint issue? You might give them a cortisone injection. If you don't have that natural adrenal function, you're going to be able to quench that fire. Likewise, we know that if you have excess adrenal function, and you, of course, you're going to load on the weight will contribute to increased C-reactive protein. So either angle, treating the adrenal glands is critical. And so when we're looking here at the cortisol curve, we're looking at, okay, the optimal level. That person may control the inflammation. But I can tell you that when I have a patient with out-of-control inflammation, I always look at the adrenal glands and see, are they producing sufficient cortisol and cortisone in order to actually quench the inflammation? Or is that one of the mitigating factors? Sure, we have to find the cause of the inflammation. As I describe to my patients, I hold up my finger as I'm talking to one of my patients. I says, what can I do if my finger hurt? And they'll say, well, you can do Advil, ibuprofen, you can do Tylenol. So, of course, being holistically